Hello and welcome to my channel. My name is JazzyRN. I have been a remote utilization review nurse for over 9 years, and I've worked for 2 different companies as a bedside nurse and 3 different companies as a remote nurse. And my goal for my channel is to help you pivot from bedside nursing to remote work. This first company is with Blue Cross Blue Shield. I believe this is South Carolina, and they're hiring a stop-loss RN. Now here it says work at home anywhere. Now anywhere, I'm assuming it's anywhere in the United States and not internationally. So this job was full-time. It was shown posted as yesterday, and the end date is April 7th. You have 6 days to apply. And we are currently hiring for a stop-loss RN to join Blue Cross Blue Shield of South Carolina. In this role, a stop-loss RN, you will evaluate and manage catastrophic episodes of illness for underwriting and claims, ensures that the insured is receiving the best medical care, but in the most cost-effective manner. The job is full-time. You'll work from Monday through Friday, 8 a.m. to 4:30 p.m. Eastern Time, and you will be fully remote. I always go straight to the qualifications or requirements. The required education is associates in a job-related field. Degree equivalency is graduate of accredited school of nursing. Required work experience is 10 years, 5 years clinical plus 5 years medical management experience. Required skills and abilities include working knowledge of word processing software. That's just Microsoft Office. Excellent verbal and written communication skills, ability to work independently, prioritize effectively and make sound decisions, working knowledge of managed care and various forms of healthcare delivery systems, working knowledge of catastrophic claims, costs, medical vendors, case management, demonstrated customer service, communication, and organizational skills, analytical or critical thinking skills, ability to handle confidential or sensitive information with discretion. Required software and tools is Microsoft Office. Required licenses and certificates is active RN licensure and state hired. They do prefer you to have a bachelor's degree in nursing, and they do prefer a work experience of 10 years as a medical staff nurse, experience working with a stop-loss carrier, and providing underwriting and claims with medical cost projects. This is a position I've never heard of. I just found this one, and it's quite an interesting position. The next job is with Blue Cross Blue Shield of Tennessee, and they are hiring a medical case manager. This is full-time. The end date to apply for this one is on April 7th, and the role leverages telephonic nursing and digital care delivery to educate, support, and coordinate care for members, ensuring timely, personalized, and whole-person support across the continuum of care. And the qualifications for this one is to be the ideal candidate for this role. You are passionate about women's health and experienced in building trust through telephonic nursing or case management. You have 3 years of experience in women's health care, maternity, gynecology, women's health care management, or telephonic nursing. Let me just scroll past this and see what they state about the job qualifications. Here we go. You must be an RN with active license in the state of Tennessee, or hold a license in the state of your residence if the state is participating in the Nurse Licensure Compact Law. For your experience, in which you have 3 years clinical experience required, that is considered bedside experience. 5 years experience in healthcare industry, so you've worked for a healthcare company. For Select Community and Katie Beckett, I'm not sure what that is. It is 2 years experience in IDD for Select Community is required. And skills or certifications include excellent oral and written communication skills and PC skills required, basic Microsoft Office and email. Make sure on your resume you have the platforms that you have used in the job you work now and any prior job. So that platform can be Microsoft Office. You see how right here the job description has Microsoft Office? Make sure your resume says Microsoft Office. The applicant tracking system will not pick up Microsoft 365. You want to make sure it uses the same exact wording, your resume, as the job description. Also include the platforms you've used. If that's Epic, Cerner, Meditech, Protouch, all those platforms are transferable skills and knowledge that can be used for your new remote job. And there's only one opening for the medical case manager. The next job is with also Blue Cross Blue Shield of Tennessee. They're looking for a clinical review manager, LPN. The end date to apply for this job is on April 7th. You have 6 days to apply. This job requires an LPN license with active license in the state of Tennessee, or hold a license in the state of your residence if the state is participating in the nurse licensure compact law. You must have 1 to 2 years clinical experience required. That's at the bedside, clinical experience. Knowledge of community resources, benefits, and service authorization processes. Familiarity with care management frameworks and regulatory requirements. High attention to detail with the ability to document accurately and meet regulatory standards. That's NCQA, URAC, and CMS. Any job you work for, working with an insurance company, or you're working with the insurance company for a hospital, they will teach you about the NCQA, URAC, and CMS. I also suggest whatever company you're working for now, the hospital or whatever company it is, look at the internal website where you perform or complete your modules. So let's say your continuing education modules. You know how whenever every year you take cybersecurity modules and HIPAA compliance modules, do a search on that site and look for NCQA or URAC or CMS. Look up utilization management. Look up interqual. Look up MCG or Milliman. Look up anything regarding remote work or regarding working as a remote nurse. You actually can take some classes on that internal site, and sometimes the classes are LinkedIn courses. The 3 companies I've worked for all had LinkedIn courses I could take that were free through the company's website. And just whenever you complete the course, you want to add it to your resume. Also, I want to mention that if you were to go to the description box below, you will see this link. It is for the Cure to Bedside Burnout. I created this myself. It is a list of over 90 companies that hires nurses to work remotely. Now, most of these companies are for nurses in the United States. There are also companies here who hire nurses in Canada, the Philippines, Australia, etc. If you scroll down towards the bottom, you will see a link to my Udemy course, and it is called Remote Nursing, the Cure to Bedside Burnout. And it includes basically information about interqual, MCG, your resume, the questions you should ask the hiring manager or HR during the interview process, and more. Also, here's a link to an Amazon shopping list for office essentials. Now, all of these items I have except for this one laptop stand. I use this one instead. But I highly recommend you get a memory foam seat cushion for your computer chair. You know, your chair, it doesn't have to be an expensive chair. It can be just a regular chair that has a good back to it with armrests. And this cushion part is going to only work well for you for a very short period of time because you'll be sitting on your seat for 8 hours a day. So this cushion here that you would purchase separately from your chair can be used with any chair you end up have purchased or you currently have now. So I highly recommend you getting a memory foam cushion for your chair. The next part is, I believe there are 24 questions here. These are FAQs, frequently asked questions and answers regarding working remotely. And below that, you will also find resume tips. On the left-hand side, it teaches you about what platforms you should add to your resume. You want to promote your tech savviness on your resume because your job, you want to use your transferable skills and all the skills you've used on the bedside regarding documentation, using different electronic health records. That's transferable to a remote job. Also, write your resume with this in mind. You want to focus on what you did, why it's important, and how it relates to the job you want. You don't want to have your resume with a bunch of tasks which you've done at each job. And here's an example I have here. Proficient in electronic health record documentation to ensure continuity of care, to provide insurance payer data to determine medical necessity. And I'll show you what that looks like the next slide. And on the right hand side, this is a template of how my resume looks. Just make sure you have a very professional email address, and I have the education, professional experience, both in all caps and bold. Make sure that your tasks are what you did, why it's important, and how it relates to the job you want. Your current job is in present tense, and then your previous jobs are in past tense. Make sure you stick to the tenses, the present tense for your current job, past tense for your previous jobs. And always add the platforms you've used for each job. And next, this is bedside nursing versus insurance nursing. So a bedside nurse as a patient. Now bedside doesn't only include working at the hospital. You could work as a skilled nursing facility nurse, inpatient rehabilitation, long-term acute care, anything dealing with hands-on experience working with the patient. I'm just going to just say it's bedside nurse. And then insurance nurse, that is what I've been doing for the last 9+ years. So a bedside nurse as a patient, the insurance nurse as a member, both have the same exact diagnosis, bowel obstruction. So what happens on the bedside, the patient comes in with abdominal pain, unable to have a bowel movement, maybe also has vomiting, and the radiologic tech performs abdominal x-ray. That was ordered by the doctor, and the radiologist reads it, and it's a bowel obstruction. Doesn't matter where the bowel obstruction is located. The doctor orders an NG tube to suction the patient to be NPO and IV fluids 100 mils an hour. On the insurance side, I already have interqual criteria memorized for bowel obstruction. That's the easiest one for me. So for the interqual criteria, the member must have an imaging with a positive bowel obstruction. Doesn't matter where the obstruction is in the bowel. The member must be NPO, an NG tube to suction, and continuous IV fluids. If all these criteria are met in interqual, the insurance nurse, that's me, I can approve the authorization for this member and for the bedside nurse's patient, or the hospital's patient. And down here you'll see what you do as a bedside nurse directly relates to what is reviewed by an insurance nurse. And then on the insurance nurse side, where does the insurance nurse obtain clinical? Clinical is whatever you're documenting in Epic or Cerner or whatever platform you're using. Not just you, the nurse, documenting things. It's the doctor documenting information, the radiologist, the CNA, whoever's working on that member or patient's chart. That documentation transfers to the insurance nurse as clinical. And that's what we use to read to verify if this member meets medical necessity using interqual or MCG. And this next slide here, this part here, this is regarding interqual certification and MCG certification. Now, I'm not actually getting any kind of affiliated monies or marketing for them. Now, the jobs I've worked for, they teach interqual and MCG on the job. So let's say if you decide you want to try to make your resume more marketable and you want to have interqual or MCG certification already there, here are your options you can use. Now, I have only 1.5 years of MCG experience. The very first job I worked for, we started working with interqual, and then they changed it to MCG for about 1.5 years, and then back to interqual. The only thing I could guess why it was changed was because MCG was a lot easier to approve authorizations. And so back to the job. Now, this was Clinical Review Manager LPN. We completed the information about this job. We're going to go to the next position, which is with Baylor Scott and White Health. They are hiring a Denial Resource Center RN, and this is full-time. It's a day job. And the requirements for this job, so right here they have the salary. It is $40.35 for entry-level qualifications and $62.52 for highly experienced. Very nice. And the qualifications is associate's degree, a minimum of 2 years relevant work experience is preferred. Applicants should be RNs. Clinical experience is 5 or more years of clinical experience preferred, with a strong ability to analyze medical records and support medical necessity. So as I said before, on this document that I created, this website, the Cure to Bedside Burnout, you can use this as an example of what you do at the bedside directly relates to working as an insurance nurse. And you can work in the insurance side either for an insurance company, or you can work for the hospital because someone in the hospital has to send these clinicals to the insurance companies. So this denial nurse position looks like they're basically reviewing these denials whenever the insurance denies authorization. They're probably the nurses to go through denial information and maybe ask for peer-to-peers, so on and so forth. I'm not going to get into that, but that's probably what they're doing, because not every authorization will be approved by the insurance nurse. Sometimes they don't meet medical necessity. So for this interqual, for example, if the patient decided to reject and they don't want to have they don't want the NG tube inserted, so the nurse cannot approve the authorization because the NG tube was not inserted. So you cannot approve it. So that in this case, I would send this authorization, or the insurance nurse would send the authorization to a doctor, and it's a doctor's decision to either approve or deny authorization. Nurses cannot deny authorizations, only approve them using medical necessity for interqual or MCG, and the doctor has the authority to approve or deny. And the last position is with VHC Health. They are hiring a virtual nurse, nursing care partner. This is per diem, which is very rare to find a per diem position as a remote nurse. In corporate America, when you're working remotely, you're usually working from Monday through Friday, 8 a.m. to 5 p.m. So finding a per diem position, that's very rare as a remote nurse, because you're not considered bedside, you're considered a corporate. So the education requirements is a bachelor's degree in nursing is required, or a associate's degree in nursing is required. So they just want you to have a degree in nursing. They want you to have 2 years of nursing or patient care experience. An acute care setting is required. 5 years is preferred. 2 years is plenty. If you have just 2 years, 2 years is plenty. I only have 2 years bedside experience. Certification or licensure is licensed as an RN by the Virginia Department of Health. Professions required, or if you have a compact state license in nursing required, they require a BLS, ACLS, or PALS. And I'm not sure why they require this, because if you are working remotely, then you're virtual. You're not going to be performing any kind of BLS, ACLS, or PALS on any patients. And the skills, knowledge, and abilities are computer skills. Typing words per minute, 60 plus. This is very rare to where a company wants you to type so many words per minute, which is a lot. 40 is a lot, 60 is a whole lot. Basic dysrhythmia knowledge preferred, and proficient with EHR, electronic health systems, which is Epic preferred. Epic is quite popular. So if you have any experience, let's say at the bedside during your clinical rotations as a student nurse, I would also include that in your resume, because that is also considered experience in Epic. So let's say the job you have now, they're using Cerner, or they're using Meditech or Protouch, but you do know Epic from nursing school, and maybe you finished nursing school 3-4 years ago, and you only had maybe 2 jobs or 1 job post your education. I would also include the Epic experience on your resume.